talk about it. Sponsored by the Harford County Health Department Minority Health Program. My name is Felicia Hopkins, one of your hosts for today, and we are so excited to be back in your homes, giving you great programming about health and public health that affects all of us out here in Harford County. This is the month of October. This is Breast Cancer Awareness Month. And today on our segment, we are going to be talking to Ms. Corey Reed from Upper Chesapeake Medical, and she's going to give us information about her program. And so let's get started. Help me welcome Ms. Corey Reed to the program.
Thank you, Felicia. I'm so excited to be here.
We are excited to have you. This is going to be fantastic. We already know that the information that you provide to us is going to be so essential. Just introduce yourself to the listening audience.
Okay. Hi, my name is Corey Reed. I am the nurse case manager for the Breast and Cervical Cancer Program at Upper Chesapeake in the Kaufman Cancer Center. And we partner with the Harford County Health Department to bring this program to the women of Harford County.
So Corey, if you can tell us and the listening viewers just how your program is run.
Sure, I would love to. So this is a program that we partner with the Harford County Health Department to bring to the women of Harford County. We also include Cecil County in this. What we do is we are able to help uninsured and underinsured women receive breast and cervical cancer screenings at no cost to them if they are eligible for the program. So what first happens in this is you would call our program office. There are going to be links in the bottom for you to click on to find those phone numbers. Our program coordinator would take your demographics, all of your information. I would talk to you about your medical history regarding breast and cervical cancer, and then we would schedule you either with one of our contracted providers in the community or with the clinic that we hold once a month after hours. It's a 5 p.m. to 8 p.m. clinic in the Kaufman Cancer Center, and I have nurse practitioners from the Kaufman Cancer Center and also one from Upper Chesapeake Women's Care who are our providers for this. And many times you can go straight from that appointment where you get your clinical breast exam, you get your pap smear, you get your HPV test, and go straight over to advanced radiology to get your mammogram. And then we follow up with you regarding the results. If you need further testing, sometimes they need an ultrasound just to get a better picture. Sometimes they need just some better imaging or some better testing. We set that up for you, we get that scheduled, we get back to you with those results. If they do find something that needs further diagnosis, then we are able to help apply you for a program for that, get you into the Kaufman Cancer Center, in to see the Kaufman Cancer Center providers, and also get that imaging done. And we're able to follow you through that course.
I remember at the age of 35, I had to start getting a mammogram because in my family, breast cancer was prevalent in my grandmother. But if you can tell the listeners, how soon or how early should they start getting mammograms if they haven't already done so?
That's a great question. So many people are unaware of that age criteria and they just keep putting it off because we don't have the knowledge. So like you said, if you're high risk would include previous history of breast cancer. A big one is genetics, like you with your grandmother. It would be family history. Then they will start earlier, usually between 30, 35. For the general public who don't have that high risk, then they start at age 40 and go from there and do it once a year.
Yes, once a year is important. You know, this is really important to me. Even as a 35-year-old, it was kind of daunting for me to walk inside of the clinic and actually know that I had to go through a full mammogram. You get stories of, you know, they're going to smash your breast, it's going to be painful. Could you give some words of encouragement or comfort that our viewers that haven't had it done yet but need to go in or delayed it because of that same factor about the process?
Yes, I think many times new things, especially medical things, can be very overwhelming, very scary. And so, because we don't know what we're walking into. So I also have already started my mammograms. Mine started at age 40. First, the mammogram techs that I've been with, the imaging techs, they are all very gentle, they're all very kind, they're all very personable so that you feel comfortable in the environment. And I found that has helped tremendously. They know your name, they know why you're there, they make small talk with you while they get you ready, they very fully explain what's about to happen. And a mammogram is similar to an x-ray, except there are two plates and your breast is placed between those two plates and there is some pressure. It's uncomfortable. I don't find it particularly painful. It's uncomfortable. So is going to the dentist, that's uncomfortable as well. So it is uncomfortable, but it's not painful for me. Different people do have different pain levels, but I think just knowing I'm going in to people who do this every day, they know how to make me comfortable, and I know this only lasts for a very short period of time, and knowing that I am safe from breast cancer for another year, that nothing has been found so far, it far outweighs the discomfort.
Absolutely, I absolutely agree with that. And just to second that, I went to or attended, is it advanced radiology? I've been there, and I can second the fact that the staff there were very, very informative. They were very personable, and I felt like, they even had snacks on the table. They had snacks and water. I loved it. So if there's any of our listeners out there that have not got their mammogram done, it is really important that you start at the age of 40 to begin to get that mammogram, and even earlier, I think 35 is what my OBGYN recommended at that time, for genetics and also for a history of it. So Corey, this is really important. We've gotten questions like, is breast cancer preventable?
So that's a great question, because we so often want to be able to prevent these things that occur in our bodies. And in some instances you can, and in some instances you can't. With breast cancer, we can mitigate the risk. We can know what increases our risk factors and address those, and that helps prevent breast cancer. If it's in your genetics, then again, that's something you can't change. You cannot change your family.
Right.
So, however, things we can change the amount of alcohol we drink. We can make sure we're exercising. We can make sure we're not smoking. And one thing the audience should know, long-term problems like diabetes and high blood pressure, those actually increase your risk of developing breast cancer. So keeping those, if you have that diagnosis of diabetes or that diagnosis of high blood pressure, making sure these long-term chronic problems are well controlled will definitely help decrease your risk as well.
Do you take people that don't have insurance? Should they not come and get a mammogram because either their insurance lapsed, they have a certain insurance that might not cover it? Could you explain more about the insurance process for our audience?
Absolutely. Would love to, because that's my job in one sense. So if you have insurance, then everything is covered, because insurances are legally required to cover basic screenings and basic clinical breast exams. Really, they're required to cover all screenings for cancer. Now, if you need further testing, like a diagnostic mammogram, an ultrasound, a surgical consult, a biopsy, depending on how far it goes, and you are underinsured, you have commercial insurance that you cannot meet that deductible, that copay, then we can help out. The breast and cervical cancer program that I work for, we can help out with that. If you're entirely uninsured or underinsured, then my program, as long as you qualify with a few of the other requirements, my program will cover that 100%. And then if there is a diagnosis or you need further testing, then at Cancer LifeNet at the Kaufman Cancer Center, we help you apply for the diagnosis and treatment program through the state, and that covers 100% of treatments.
Wow. I want you listeners to really take in the information that is given here today. It is not every day that you get this kind of bite-sized information and something that is just very relatable. So please look at our links and the phone numbers. Corey Reed is the coordinator for a lot of these appointments. Nurse case manager for these appointments. So really take a look at that, especially during the month of October. So Corey, there are questions going around now that some medical professionals say you don't have to check your breasts every month, and then there's some that say I think it's best that you still should. What do you say to the listening audience and women out there about us and our bodies and checking for this really important disease?
My biggest take home message for that question would be know your body. Know what your body feels like when everything is fine, so that when something doesn't feel right, you know to go in and get it checked. I think that is the biggest thing to know. Besides besides breast health, other things, but especially for our breasts, it's not something that we talk about very often, except in October, and then pink ribbons come out, and it's socially acceptable to do so. I'm one of those people that I'll talk about it all day long, any month. So know your body, know what feels right when everything is good, and know when something feels wrong, and then go see your doctor, go see your gynecologist.
I think that is the best response, because the only person that knows you best is you. So yes, know your body. And in a segue to that, I want all of you listeners to stay tuned, because we are going to be interviewing an author. His name is Dr. B.K. Edmond, and he wrote Nana and the Bushwoman. And I'm going to tell you something. You do not want to miss that interview with him. It is amazing, and he talks all about the steps in being aware of your body by way of checking your breasts. And he wrote it in a novel that is outstanding. So yes, that answer is perfect. Know your own body. So Corey, you've shared some excellent information about breast cancer awareness. Could you tell our audience what else does your program offer?
So we offer cervical cancer screenings as well, which includes a pap smear and an HPV test. HPV causes far over 90%, I think it's somewhere in the 97% of cervical cancers. And it also causes a lot of throat and tongue cancers. So we wanted to talk about cancers you can prevent. Let's have another segment sometime, and I'll tell you how this is the only cancer we can actually prevent. But we also offer those tests, and depending on those results, we follow up with you on that, send you for more testing if necessary, treatment if necessary. If everything looks good, then we just call you back in 3 to 5 years, depending on which test we run.
Wow, that's really good. So Corey, I'm curious, what led you to this particular field? What was your motivation behind your passion for this particular field?
So I think my main passion was a heart for marginalized communities. And I feel like the uninsured and underinsured in our society are on that spectrum of marginalized. There are so many hardworking women, so many women who are raising families, working, they're doing so many things, and yet they can't quite meet that gap of being able to afford insurance, because insurance is not cheap. And to be able to provide a safety net for these women, so they're not having to choose between paying the rent, between feeding my children, or do I go get checked out, because we will always do those things for our children. We will always pay the rent, and so very often our own health gets pushed to the side. And so I think for me, it's being able to provide a safety net.
Wow.
To catch these women who need this service, and who are so appreciative of this service, and being able to take the weight of anxiety and the weight of having the financial weight that sometimes these procedures can incur off of their shoulders.
Wow, that is so beautiful. And we thank you for your commitment to the community and to Upper Chesapeake Medical, and for the work you and your entire staff does for so many. I'm hoping that from this segment they'll be able to find the resource, find the courage to go if they have not gone, and continue getting their mammograms, and know that the Harford County Health Department Minority Health Program is concerned about your health. Well, that brings us to the end of another wonderful segment.
Felicia, thank you so much for letting us present this program to you and to your wonderful audience. We really want this information to be out in our community, and you have really pushed that forward for us.
Well, Corey, listen, we really appreciate you being here, and we look forward to having you back again in the future to talk about more of your wonderful programs. And we want to thank you, our listening audience, for tuning in today for this very important segment. We want to encourage you to not only share this with others, but also tune in next time for another segment of Let's Talk About It. Thank you and have a good night.